Okay, I'm excited to introduce our next speaker is Tobi Sherman. And Tobi will be presenting on providing gender affirming care and being an ally to our transgender and non-binary patients. Warm welcome for Tobi. Thank you so much.
Thank you so much, Jeff, and welcome everybody who's here in person and on Zoom. I'm gonna go straight into it. I don't have any financial disclosures. We're gonna define key concepts of gender identity and highlight the importance of gender affirming care, provide practical tips for creating an affirming environment within your clinic, in your office as mental health providers, provide key aspects to allies to focus on. So as you mentioned, as you heard earlier, Dr. Stapleton saying cisgender, some of you may or may not have known what that term is. That basically means I can guarantee majority of you in this room and on Zoom are cisgender. Your brain matches below your belt, okay? So for us on the transgender spectrum, that's a little the opposite, right? So the brain and the lower parts just don't match in various degrees of acceptance within the brain. And so for intersex is not only, it is not a gender identity, nor it is a sexual orientation. It is an umbrella term of those with differences of sex development, which affect chromosomes, gonads, and atypical sex characteristics. They also can identify as cisgender or transgender. Okay. So what is sex assigned to birth? Pop out into the world and doc looks between your legs and pretty much that's how you get assigned. It's either male, female, or ambiguous, which falls under the intersex spectrum, okay? So under non-binary, as opposed to just transgender, being masculine and feminine, non-binary has multiple designations underneath that umbrella. And this is the more fluid of the gender identities. Someone can identify as gender fluid. It used to be only androgynous before all these other terms came up, for those of us older folk in the room. Gender queer, agender, basically doesn't identify as male, female, or neither. So gender identity is on a spectrum, right? It's a sense of one's feeling, emotional, mental identity as being male, female, both as under the non-binary gender non-conforming umbrella, or the agender, which doesn't identify as anything. So for gender affirming care, that comes in two stages. Adolescents cannot have surgery until they're 18. The only exception came about in just recently in WPAS Standard of Care 8, which trans men at 16 can have chest surgery so that they could identify better with who they are at that moment. Okay. And usually they're at the point where they're on blockers anyway, so there's not much left, if at all. So it also goes with changing one's name, most importantly, pronouns. That one word right there can lower someone's depression scores across the board. And maybe even that day, you be the person using the right pronouns, makes that person not want to commit suicide that day. Pronouns are very powerful words. They also change the bathroom usage. And unfortunately, some will hold 8 hours or more going into a restroom just out of fear. Participation in social events, gender-based. Now we have seen bills across the country that no longer allow trans women or trans men to be on a team of their gender. So that plays into their mental health status also, and comfortability within themselves. So for the physical affirmation, generally starts off with hormones. And if a person was on blockers as an adolescent, there's a time into the early 20s where that's sussed out as where the blockers are backed off and the hormones are increased, so that the effects are continued into a more positive hormone direction. For those who want surgery procedures, not everybody does. That would be the next step, whether that's just top surgery and taking care of the chest, and or bottom surgery. Just depends on the person's preference and what makes them feel most autonomous in their own body. Okay, that's huge for mental health right there. So some of the gender affirming medical practices is, as I said, the blockers in adolescence. Pausing that puberty, allowing that minor to take that pause and really suss out, what do they want? Where are they? Do they have the support of their family to go through this? Because it's not only a change for the minor, it's a change for the family members as well. Right? So adults can start, like I said, right at 18 to start their transition on hormones. Standards of care number 8 also allows now physicians to do informed consent if they're so comfortable with that. Otherwise, the other route is still to be getting a mental health letter to start hormones. And depending on the patient preference, facial reconstruction is also available for both male and female, and body contouring. So microaggressions, as we're experiencing heightened these days right now, is also extremely important to address when we're dealing with any minority other than the privileged. So what can we do to create that calm, inclusive environment is a Pride or HRC or both sticker on your window, your door, community magazines, posters, other cues that it's a safe place, asking their pronouns, and if they've done their name change, so you can change the records. Intake forms and training staff who are competent in feeling these patients, making these patients feel comfortable. In allyship, out of the 2022 US Trans Survey, the most prevalent thing that the adults would like to see changed is the violence towards us, so that we no longer 11th, 20th of every year have to come together in a remembrance of those that we've lost every year. And in the youth side, one of the biggest things they said that caught my attention in this was that they know someone who is transgender, LGBTQ, but they're reaching them on the internet. There is no face-to-face. It's very little, which also is not a safe place to be, because you truly don't know who that person is on the other side of that screen, especially for the next 4 years. I can't tell you, I've gotten increased calls on what's going on and what are we doing. So the panic is there. And as you were saying, Tim, and that getting us in the door is the biggest problem. And you're right. And Dr. Stapleton's figures on HIV is exactly what I sussed out, and it hasn't really changed. So in the same action, the youth, one of the main things that they took away from the survey was 88% of them wanted to just be heard and taken for their word that they know who they are. I myself at 6 months knew who I was through unfortunate means. So some of the suicide risks by sexual orientation and gender identity are still rather high. Now, again, what do we do? Tim, your guys who don't know where to go, get them in touch with the center. Right now, I think the best thing that we can do is go back to one of our 80s tactics and outreach to our young and show them it's a safe place, safety in numbers, and go back to that mindset philosophy like we did in the 80s. I really think that's what's going to make the difference right now. And all of us get through the best way we can and skate through the next 4 years. These are my resources for providers, which are in your packet.